The COVID-19 outbreak here at St. Boniface Hospital gets worse. An internal memo sent to staff says more people have tested positive for the virus and they're shutting down another unit. On Friday, 2 people tested positive on E6, a general medicine ward. Due to the vulnerability of the setting, it was enough for the province to label it an outbreak. The hospital at the time closed the unit but kept the hospital open while it traced contacts and beefed up cleaning efforts. Now, more positive tests are coming from another unit, E5. In total, 16 cases, 11 patients and 5 staff. The St. Boniface Hospital Communications Director declined an interview and referred us to a statement on their website. It reads, "Outbreak protocols have been implemented at the hospital to ensure the ongoing protection of patients, staff, and visitors. All potential contacts between October 5 and October 20 are being traced so that they can self-isolate and, if necessary, be tested as we investigate the origins of the transmission." When asked why they're considering the cases as 2 separate outbreaks instead of one, the communications director said the investigation is still early and they don't know how it started. The Manitoba Nurses Union says at least one of the positive staff tests is a nurse. In a statement, they say, "Unfortunately, the employer has been slow to communicate and address increasing concerns among staff, patients, and their families. In order to contain any outbreak, it is imperative for communication to be shared as expediently as possible so that affected staff are aware of the facts and measures being implemented and can take the necessary steps to protect their patients and themselves." In an effort to contain the virus, the units will not accept new patients and restrict visitor access. The hospital remains open. Clinics and procedures are continuing. The death rate from COVID-19 outbreaks in healthcare settings is about 9% across Canada. 2 people died from an outbreak at the Health Sciences Centre that affected 25 people in the spring. We'll continue to monitor the situation here and bring you updates as they're available. At the St. Boniface Hospital, Stephanie Lasuc, City News.